Thank you, baby. Hey, everybody. Sorry. Okay, I'm coming on a little bit early because I wanted to go ahead and get everybody here on the same page while we wait for Dr. Karlin to get here. So, welcome to my channel, Discovering Nicole. That would be me, Nicole. And today what we're going to do is we are having, why do I look cross-eyed? We're having Dr.Dan Karlin come on from Recovery Delivered. For those of you guys that do not know, I have been working with Recovery Delivered I've been talking about them for 2 years, since 2020 when I met them. And then just about 5 months ago, we joined forces and they gave me like a 50% off code for you guys. So that way you could get your SUBOXONE treatment for cheap. Okay. So that's the plan today. You know, he's a doctor, so I don't know if he's going to be here straight up at 2 or if he's going to be running late. So if you guys have any questions about my experience with SUBOXONE and how I'm doing on it, feel free to ask anything, any questions you want to ask. Okay. What I'm going to do right now is I'm going to start sharing this video. So just bear in mind, that's what I'm doing. I'm not trying to ignore you guys. You know, it's a lot of work getting everything going over here. Yeah, we are live. So for those of you guys that don't know, I got on medication assisted treatment in 2015. Okay, I got on SUBOXONE. I had never been on SUBOXONE before in my life. The reason why I got on it was because my son got taken away from me by CPS. And when that happened, that was something that I never, ever thought would happen to me. I never thought that would happen. And so when Nathaniel got taken away, I went into a residential treatment program called Oasis, and I stayed there for 30 days. After those 30 days were up, I got out, and my husband picked me up, and he had gotten on SUBOXONE. And at that time, I didn't know anything about SUBOXONE. I was really just ashamed and embarrassed. And I was mad at my husband because I felt like he was trying to like get over. And all the stuff that I had ever heard about subs was that really, really negative, right? But I knew I also needed, I knew I needed help, and I knew I could not screw up. I knew if I screwed up that I would lose custody of my son forever. So SUBOXONE, and the rest is history. It saved my life. I have been able to maintain sobriety for the last almost 8 years, 7.5 years. I've had no relapses, no dirty urine screens. I moved into a new place. I got my own car. My husband has his own truck. We have money in the bank saved up. Like, we changed our lives, and we used to be like homeless, you know? So anyways, I think Dr. Dan is here, so I'm going to pull him up here, you guys. I have questions that I'm going to be asking him, but if you have any questions, just put them in the chat, and I will ask them, okay? All right, let me see. Hey, Dr. Dan.
Hey, good afternoon.
How are you doing?
Oh, I can't complain.
Good, good, good. I'm so excited to have you on. I love Recovery Delivered. I think they're amazing. And I had Marcus on probably like 2 months ago, and I just wanted to have you on because he said you're the main man there.
Oh, I don't know about that. I mean, you know, having now run in-person clinics for folks with addiction and psychiatric needs, and now contributing to a few different you know, fully remote efforts. It's almost never the people in charge who, you know, it takes a little bit of vision and a little bit of a push to get these things started. But the reality is that it's the folks on the ground, as it were. You know, it's the folks on the other end of the video or the telephone call who actually make a difference, because so much of this is not just about, you know, getting the right medicine at the right time, but it's about feeling connected to a place and feeling secure that you'll be able to keep getting the medicine, and that you'll have someone to talk to if your situation changes. And you know,
that's a huge issue with a lot of people that I talk about, is that they are going to this clinic that's in their town, or maybe their car broke down and they can't make it, or the doctor just all of a sudden decided he was going to retire, and then they don't know where to go. Can I ask you, like, how you decided to get into helping people that struggle with addiction, or like, is that something that you specialize in? Can you share a little bit about your background and stuff with us?
Sure. Yeah. So I'm trained primarily as a psychiatrist, which a lot of folks get into addiction medicine from different angles. My psychiatric training was in Boston at Tufts University, Tufts Medical Center in downtown Boston, and the way a little bit esoteric to even get into this, but the way that medical training works is when you go to residency, you're supervised, right? And so you get what's called a training license, which lets you only work in the system that you're a part of. But depending on the state, after a year or two of training, you're eligible to get a full medical license, which lets you practice on your own. And so when I was doing this, it was sort of right as the full scope and damage and extent of the opioid crisis was turning into the death crisis, right? So as we start to see fentanyl increasing in the drug supply, unpredictable amounts of fentanyl in the drug supply, and it became clear that folks using what they hoped was IV heroin often wasn't, and so it went from a lot of people taking a lot of different opioids to a death rate that just, it still doesn't seem to have a real ceiling. And so I took my new full medical license and I joined up with a group that was providing SUBOXONE services fully in person at the time, uh, down the street from where I was training. And that's how I got started. It was a clear need, and I usually did like 2 evenings a week, and in a couple evenings a week, I could treat 20 to 40 people, and that seemed like sort of what I should be doing to try to help stem the tide and make sure that as many people who wanted to get uh, Suboxone, buprenorphine prescriptions could get them.
Yeah. Do you enjoy working with people that struggle with addiction? Like, is it something that challenges you and gets you excited? Because I know I'm in recovery, but I really enjoy working with people who struggle with addiction and trying to help them. It's something new every single day, and I look forward to it. What about you?
I sure do too. And I think what I would offer is that I'm sure that some of your viewers, your listeners, have had less than ideal experiences with the
Yeah.
healthcare system and with healthcare providers. And there's this strange bifurcation of providers, right? There's sort of two strands, and there are folks who don't intentionally treat people with addictive disorders, but they end up encountering people with addiction disorders, right? And that can be primary care docs, it can be ER docs, particularly, who sort of see a patient with addiction as engaging them to try to achieve a goal other than the stated goal. So when a patient comes in to see you, mostly you and the patient want to agree what the goal of the encounter is, right? And the trouble that a lot of doctors sort of learn in their training and in their practice is, oh, you can't trust people with addiction because they'll come in and tell you they're there for one thing, but really they're there to try to enroll you in supporting their addiction. And,
Right.
and the really neat thing that happens when you start intentionally treating people with addictive disorders is it changes your orientation a little bit toward that. And you start to recognize that, first of all, when folks engage the healthcare system to try to further their use of substances, well, that's a disease process also, right?
Yeah.
And,
Yeah.
and the really great thing about intentionally treating people with addictive disorders is they come in and right off the bat, you're talking about the addictive disorder. You're talking about
Yeah.
substance of interest. And one of the most interesting parts about that is that someone comes into a clinic and says, hey, I want to stop injecting heroin, or I want to stop taking oxycodone or whatever else. It's like, okay, cool, that's easy, I've got some things to help you with that, and we know exactly what we're going to do. And then it's like, oh, do you smoke cigarettes? They're like, yeah, I smoke a pack a day. I'm like, well, we got to stop that too. And they're like, well, I just came in here to stop using 4 bags of heroin a day. Why are we talking about my cigarettes? Well, because cigarettes are going to kill you. So
Yeah.
it's all about trying to both build alignment around goals and then see where there are other areas you can help. But when you start from the standpoint of, I'm here with the goal of either reducing my substance use or stopping entirely, well, that's good. Now we can align on goals. And what I tell people right off the bat is, you came here saying you had a goal. We're going to work together to help you achieve your goal. If your goal changes, just let me know, right? So
Yeah.
if you've changed your mind to decide that actually, you've relapsed and that's the state you're in, and you don't actually want to move toward the goal that we discussed, that's okay. You can keep seeing me even if you're using substances again, whatever it is, because I'd rather you come back and we keep thinking about those goals together than you decide that just because you're not a buprenorphine patient right now, you need to just disappear, right? And that's another thing that I think folks will often find as well. They relapse, they're using again, and now they can't get their psych meds, right? They can't get their SRI or their whatever else it is. And that's like the worst time to stop taking an antidepressant, right?
It's a level, it's like a shame level, because like whenever I would have relapses in the past, I would be so embarrassed to like go and say something about it. And I will tell you this, I'm kind of like anti 12-step programs, and there's a reason for that, because there's like a level of shame that those programs bring in when you relapse. It's like, listen, you've been sober for 5 years, but you relapse for one day. Oh my God, you have no sobriety now. No, what about all those the 5 years that you stayed sober? All that positive stuff, that one day or that one week that you were getting high, like that's an experience that you needed to experience so that way you wouldn't make the same mistake again. And so I'm all about like trying to help people to understand that like recovery is like a process, and it's never been like a straight line for me. Like I'm up and down, up and down. But since I got on SUBOXONE, I have been able to stay sober for almost 8 years. That's the longest amount of time. I couldn't make it past 6 to 9 months when I was out there trying to do abstinence through 12 steps. So that's why I'm such a big advocate for medication assisted treatment, because it saved my life and my husband's life.
And that's fantastic. I mean, so here's the thing, right? That we all kind of acknowledge that, say, major depressive disorder isn't the same for everybody, right? It's a final common pathway, and people's depressions look very different. The same is true for addictions. That yeah, sure, you might use the same substance as the person sitting next to you, but your disorder, right, is not the same as theirs. And so that for some people, and this is why the things can get a little religious and I don't mean like God religious, I mean more just faith-based in addiction treatment, that it's like, well, what worked for me must work for everybody. And the best thing we can, I think, do for folks is to meet them where they're at and try to figure out what combination of interventions is most likely to help them live the life they most want to live. And for some folks, 12-step programs work incredibly well. For other folks, they are repellent, and they can never imagine participating in them. And most in the middle is almost everybody else who might want to try, or might want to try to find a 12-step program that doesn't treat prescribed medication as being not non-abstinent, or whatever the term you want to use is. But I mean, in general, if we can't even agree over like what a word like abstinent means, that's a problem. And so
yeah, what does it mean? Like if you're on medication that's prescribed to you, like wouldn't you still be being abstinent because you're not taking like drugs that are not prescribed to you, or illicit drugs? What do you think?
I don't. So my trick for things like, for words like abstinent, is just to avoid using them. So why does it matter what abstinent? Let's just talk. Let's try to have the conversation without using a confusing word. Is often the place to start. So if nobody agrees what abstinence means, let's talk about the actual things we're talking about. So if your goal for yourself is to take prescribed medicines only, and you're being responsibly prescribed medicines, of course, because if we think about some of the origins of our current opioid crisis, of course, there was some irresponsible prescribing. So the definition can't just be, well, I got a doctor to write a script, right? Because if we use that as the definition, you're going to be able to find things that maybe aren't what should be prescribed. But yeah, to me, taking responsibly prescribed medicines and not using substances that you acquire via other means, at least is much more likely to keep you alive. Right? At least the things you pick up from the pharmacy contain what they claim to contain in the dose they claim to contain it. And so, at that level, at least, if you take things as prescribed, they're probably not going to result in a bad outcome. You're not going to end up in ICU. You're not going to end up dead. And so that, if we really take a harm reduction approach here, that is really trying to keep people, one, alive, but alive with some quality of life.
I love harm reduction. I'm all about that. Okay, let me switch gears with you. Now I want to talk about recovery delivered with you, because I have tons of people that message me every single day. I know you know this, and they have all these questions, and for the most part, I can answer most of them. But I like to have you on, and you can explain things better. So I want to help. If somebody has opiate use disorder, what qualifies them to be a good candidate for getting on buprenorphine products?
I mean, buprenorphine, to my mind, is the best psychiatric drug that exists. and is one of the best overall drugs that exist. And by best, how do you define best? I mean, it's a drug that's most likely to have the most meaningful change in someone's life over the short and long term. And buprenorphine works so well because we call it's a partial agonist. All of the opioids you think of, whether they're prescription like oxycodone or heroin or fentanyl, they're full agonists at the mu opioid receptor, which means they bind that receptor and they effectively turn it on. And all of the effects that people experience, both the good and the bad, right? The pain relief, but also the difficulty stopping, the respiratory suppression, all the good and bad are mediated by mu opioid. And if you use too much of a full agonist, that's where you get, full respiratory suppression and ultimately, anoxia, which can lead to death if it's prolonged. Naltrexone and naloxone, which I'm sure folks are familiar with, right? Naloxone, everyone should have naloxone, Narcan, and increasingly you can get Narcan for free via services on the internet, via pharmacies, even without a prescription now, are mu opioid antagonists. So they block the mu opioid receptor. So one is, the drug itself, full agonist. The reversal agent is a full antagonist. They're opposite one another. Buprenorphine is so neat because it has both agonist and antagonist properties. And so it very tightly binds the receptor, but it can only bind the receptor so much, and it blocks the rest of the receptor. So that's why folks will find.
So you're not getting high off of it, like a euphoria.
It's a very different experience. And for folks who take, I don't have I've never taken buprenorphine, so I can't tell you what it feels like. I can tell you what a lot of people have told me what it feels like, which is, particularly if you've been using quite a bit, doesn't feel like much. It feels
right. It's like a total relief. If you're coming off fentanyl or heroin, it is like, okay, I feel like a normal human being now. When I got on it, I had 30 days sober from all drugs and alcohol. And when I got on it, I started out on 8 milligrams, and it knocked me for a loop at the beginning.
Yeah.
But I was groggy, but I knew I needed to have some kind of insurance plan on my sobriety, especially dealing with CPS, Child Protective Services.
Yeah.
But
so,
I love SUBOXONE. Like, I will scream it from the rooftops because it saved my life, and I want other people to have access to it,
And so you said that was 8 years ago, and that was kind of normal, for 8-10 years ago, we would do these full sort of detox. You'd get admitted somewhere, you'd get washed out of, you'd go through withdrawal, but with some supportive medicines, you might get down tapered on something. These days, the value of making someone go through a detoxification period prior to starting treatment, if you're going to put someone on bup anyway, why wait? And so
exactly.
Really the only, if you're acutely on a full agonist and you take buprenorphine before you go into withdrawal, it will do something called precipitated withdrawal, which will be uncomfortable. You're not going to kill you, right? Nobody dies of opioid withdrawal, but it is really uncomfortable. So really, the only waiting period anymore that you have to deal with is wait till you can go into a clinic, or in our case, you can start engaging online and on video with the clinic while you're still using, and be ready to stop using as you get your prescription, so that and then it's just a waiting period. You wait till you're in active withdrawal, and then you take the first dose. And what the folks who prescribe it can do is walk you through how to take a little test dose to make sure you're in enough withdrawal, how to treat yourself through precipitated withdrawal, even if it happens. But in general, for most people, the best bet is not to try to go 30 days or 20 days or 10 days. It's a day. It's a day of transition. And so getting on bup can it's like, decide you want it today, depending on how you access it, you could be on buprenorphine tomorrow.
Yeah. When people come to Recovery Delivered, do they have to have a negative drug screen to be able to get on SUBOXONE, or can they already be sober or already on subs and come there?
Any of the above. So if someone comes in with a fully negative drug screen, good, and they've done it without medicine, like good for you. That's hard.
Yeah.
And I bet that wasn't pleasant, if someone, but you can imagine someone who'd been in prolonged recovery, had been tapered off SUBOXONE 2 years ago, and is now undergoing some stress, and they're worried about relapse, so they want to start back on it. I mean, there's almost any condition that you can come to us, and again, I love supporting Recovery Delivered is something that brings me a lot of pleasure working with the folks. Again, you should try to have someone who actually does the treatment come in, because I'm one
That
level
would be so cool.
and I'm sure that there are folks who'd be willing to do that. They're proud of the work they do, and they're proud of helping people do better. But the point is that you can have opioids in your urine. You cannot have opioids in your urine. The urine test at the beginning is just the baseline, and so really all you need to start engaging with in care is a desire to have some treatment and to feel better and to use less drugs. Use no drugs would be ideal, but that's the starting point. And again, this is what's so important. The starting point's a conversation with the provider about your goals and what you want for yourself, and where you see yourself going with that. Because stopping using drugs is it's important, but it's only part of having a satisfying and meaningful life, which ultimately should be the goal of all this.
I want to ask you this question because, okay, so you said something about precipitated withdrawal, and that's one of the things that I always, a lot of people call me because they're afraid. They have put themselves in precipitated withdrawal before, and I want to tell you what I tell them, and you tell me if this is a good thing. So I found this thing on the internet called COWS, Clinical Opiate Withdrawal Scale. And so I always tell them to get somebody with them that they trust, like their mom or dad, and have them give them that test to make sure that they're in severe enough withdrawal before they take the SUBOXONE, and to take it like little pieces at a time, like 2 milligrams for 20 minutes, then wait, then another 2 milligrams, like that.
It's perfectly good advice. There's no perfect way to initiate BUP. Once you've done it once or twice, you transition from using something else to being on SUBOXONE or another form of buprenorphine. You kind of know yourself. You know where you need to be.
Yeah.
And tolerating a little discomfort before you start reduces the risk that you precipitate withdrawal. But worst case in precipitated withdrawal is you take some more BUP. You kind of treat yourself through it. And again, that's something you can work through, obviously with peers, but with providers. With it's not a great reason not to stop using street drugs because you're worried that the prescription might suck for the first.
Right. Not a good reason, but I'm telling you, these kids are so afraid. Like, this is the first thing that I get asked about a lot is the precipitated withdrawal. And so I just tell them, hey, listen, here's my cell phone number. If you run into a situation, you can't get a hold of everybody, just text me, give me a call, and I will be there to support you like your little cheerleader.
And that's sort of, I think, that's a broader concept here, because the best conception that I've heard of addictive disorders is that they sort of replace human connection and are also a path to human connection, right? People you use with, people you buy from, people who are using next to you, people who are on the same pursuit of substances that you're on, that they substitute for themselves human connection. And for some folks, that's your social world. And so the antidote to that is connection. And so, we talked a little bit about 12-step, but of course, 12-step programs are about people with shared goals connecting, and sponsors are about having someone you can rely on and call. And so, again, not advocating 12-step for anybody or everybody, because I don't even know who's listening to me talk right now. So we'd have to figure that out one-on-one. But finding connections in the recovery community, and then also, and this is hard, disconnecting from the people and places that you used with and that you acquired drugs from, really important. So, both the sort of the curse of this, but also a really nice thing is that it turns out that buying drugs requires multiple steps, right? You got to go to a place where you buy drugs or text someone you buy drugs from. And see, the further you can get yourself away from the drugs, the less likely you are to relapse, right? So someone who has trouble with alcohol, well, they shouldn't have alcohol in the house, right? Increase the work of doing the thing that you don't want to do is a great plan. But that means replacing those connections, the people you used with people who either don't use and aren't in recovery, or people who don't use and are in recovery.
Yeah. Can I ask you a question? So you say a lot, you talk a lot about establishing goals with your provider. So when somebody is meeting with their provider at Recovery Delivered, like, what are some realistic goals for someone who is like they're just coming off fentanyl. They are a hot mess. They're homeless. They're just got a job and they're living out of their car. Like, what are some realistic goals for them to set and start knocking them out? because I feel like a lot of people get overwhelmed at the beginning.
Yeah, and even your description of someone's situation there, which I have a feeling probably resonates with a lot of people, is that's stressful. It's uncertain. It's hard. Right? These are the sorts of things that lead people to turn to the relief from substances. Right? Is being in that difficult situation. So trying to meet your needs. Right? So living out of your car. That's always going to be stressful. Makes you feel like you're at risk of a bunch of things. So,
Yeah.
is there a source of stable housing that now that you're in treatment and not using, that you could potentially access? Or are there people in your life who, while you're using, don't want to be in your life, but while you're not, would let you back into their life? Are there connections that you can go reestablish with parents, with siblings, with old friends? Are there people who will let you crash at their house while you're not using, who wouldn't while you are? But letting folks know that and this is another way of checking ourselves and kind of keeping ourselves a little honest, right? Is can you let folks know that you're making this effort, and see if there are people around you who want to be a part of that effort with you, want to try to support you through it. Having a job is awesome, right? So you have a
Yeah.
job. So set goals around performing at that job, doing well at the job, base case, keeping the job. So, getting in on time, working hard through the day. Something I say often to folks in treatment for all sorts of things is making friends requires making plans, right? It's the only way you make friends is making plans.
Yeah.
Getting me on your live stream required making plans.
I know.
But having connections requires plans. And so can you set a goal around making some outreach and making some plans, even if it's to new folks? Can you find a group of people who have a similar interest to yours? Reestablishing a connection to things that are interesting to you. So the goals don't have to be so lofty. By the end of the year, I'm going to be back in school or whatever it is. Set reasonable near-term goals that you can actually look at and tell yourself, well, I made this goal. Well, I missed this one. Why did what went wrong? And discuss with your provider. So here I was trying to find housing, but I'm still in the car. Here's what I've done to try to find housing. Maybe a psychotherapist or a counselor would have some ideas for other things you could try to do to get yourself housed instead of being stuck in the car. And similar with connection, I reached out to this many people, and I managed to go, have dinner at this person's house. These little things, little bits of sort of normalcy that maybe your life looked like before you found the substance that you found, or just like how you'd like your life to look moving forward.
Yeah. Yeah. Okay. I want to ask you, what do you think? Because so this what you're in right now is the community. So in 2017, I started my YouTube channel, and I was like, I'm going to stick up for us people that are on MAT. I'm on a mission, and I've been on a mission ever since. So this is our community. We want to know, what do you think about? What is your opinion on when people say? Because I know a lot of people, when they get on SUBOXONE, they go to their family, say, "Mom, Dad, I'm finally sober." You're not sober. You're just trading one addiction for the other. What do you tell your family if they're telling you that, and you are like so excited to finally feel like a normal human being again?
Yeah, I mean, it's really unfortunate that there's that stigma, and I mean, that's like telling someone who has poor vision and needs glasses to drive or to see that they're addicted to their glasses, right? It's like telling someone who's on an antidepressant they're addicted to their antidepressant, because if they stop taking it, they'll get depressed. As much as it's hard, because we really conceive of, as medicine, we ought to, and many of us do, conceive of addictive disorders as disorders, right? It's like any other disease, except, and here's where people struggle. Addictive disorders lead to this behavior, which seems like a complex intentional behavior, right? And so trying to remind folks in your life that, look, if I could not be on this drug, I would not be on this drug, right? But this drug enables me to function in the world, to not be using substances that are increasingly likely to kill me, and is safe. It's prescribed by a responsible physician at reasonable doses. And I unlike substances of abuse, I take the same dose at the same time every day. And I'm engaged with a physician, and it's helping me to live a normal life. So I guess you can call it trading one substance for another, but that seems narrow-minded and short-sighted, given that this even in that conception of trading one substance for another. I'm trading one that could very likely kill me for one that will almost certainly keep me alive. That seems like a worthwhile bet.
Yeah, absolutely. Totally worth it. Totally worth it. So what is the process like if somebody says, hey, Nicole, I want to do Recovery Delivered. I want to get on subs. Do you know the process that they need to go through in order to connect with Recovery Delivered?
Pretty sure you just call the number on the website.
Call the number.
I think it's that easy. I think you can also do it via an online. There's an online form you can do it. So, I mean, the goal with Recovery Delivered was to make, and again, I'm a fine spokesman for Recovery Delivered. I'm telling you, there are people out there who
you're doing great. I think you're amazing.
Well, who do so much more for the actual patients of the organization. I'm there to help the clinicians when they need a little. So something that everyone should know is that if you're seeing a provider, they almost certainly have a supervisor. And by supervisor, it's not like boss supervisor, but in the world of psychiatry, a supervisor is someone you talk to about your patients to make sure you're doing the best work you can. And so
I actually talked to one of the providers that works with Recovery Delivered. Her name's Terry. She's I think a nurse practitioner.
Yeah.
And I've been talking to her. She texted me this morning, and I said, I'm going to have Dr. Dan on. So after I get done with him, we're going to talk. And then I think she might be able to come on and share too.
She's great.
It's just a convenience to be able to get your medication online. I even enjoy that because I struggled, when I was going to my SUBOXONE doctor, they started saying, well, you can't bring your son. And I'm like, I'm a mom. Like, I can't, what am I going to do? Tie my leash and put him outside? You know what I mean? Like, he has to come with me. And so it just makes it so much more convenient for people to be able to, get medication and maintain their sobriety. Yeah. So I put a link for you guys, just so you know, in the chat. If you guys want to, or if you're looking for buprenorphine and you need to get on it, you just click that link in the chat and it'll take you to the app, and then you can fill out all the information. And if you need any help, I will help you. Okay, just text me and I'll help you out.
And look, what I said before about connection, this sort of a community saves lives, right? And it offers connection to folks who maybe would have no other way to meet otherwise, but are struggling with similar issues, not the same, but similar issues, who are then able to compare notes and talk to each other about what helps them and try things. And so much of the process of recovery is experimentation, right? It's saying, well, this combination of things helps me to not use, and you discover what works for you. And don't just, the medicine, the reality of buprenorphine containing medicines is they are really freaking helpful. And you got to put the rest of your life together too. Buprenorphine is not going to put your life together, but it sure ought to help you feel better and reduce cravings and help you not use opioids, whatever your opioid is.
What I always tell people is I tell them that, SUBOXONE is like 4% of your recovery. So the other 96% is like the efforts that you're putting into changing your life, the effort that you put into getting a job, making sure you're at your appointments on time with a doctor, taking care of your home, whatever you're doing that to change, changing negative behaviors, healing relationships, making amends, all those things. Because people used to say, oh, well, that's the only reason why you're sober is because you're on SUBOXONE. If you weren't on SUBOXONE, you would be sober, and I'm like, no, that's not true. I could be doing all these different drugs since I was addicted to multiple drugs. And this medication is a tool that is assisting me in maintaining, you know what I mean? And it helps me with my depression. Have you noticed that? I got off of it in January and I was so depressed. And once I got right back on, a little dose, like less than 1 milligram, I was not lifted my depression. Do you guys have experience with that?
We talk about this in psychiatric circles often. There is clearly a form of depression that is opioid responsive. And of course, if you have an opioid, if you're the kind of person where you are depressed, if you're not on opioids, that of course predisposes you to using and potentially misusing opioids. So and again, it's this mu receptor, if a little bit of mu activation keeps you from being depressed, buprenorphine is an amazing drug to help you get off of opioids that you're using from the street or that are being overprescribed. And there's no, so people talk a lot about the course of buprenorphine treatment, and there are some people particularly if you get to buprenorphine and stop using opioids early in the course of your illness. So, you got prescribed for whatever, and now you find you're using more and more, and you go, whoa, hang on, this seems like a bad path. Let me do something about this. There are folks I've treated for a few months with buprenorphine who never used opioids again. They discovered that these things were going to be really hard for them to not use when they had them. They took action immediately. Lucky folks, right?
Yeah.
There are other people who start treatment, and over time they discover they need less and less to not have the feelings and to not start to worry about relapse risk. And so working with their prescriber, they're able to cut down that dose over time and eventually come all the way off. There are folks for whom either kind of high dose, full dose buprenorphine is a lifetime need, and that's all okay, right? This is like any other medicine. It's about figuring out the dose and the timing and the frequency and ultimately the duration of treatment that you need to achieve your goals.
Yeah. Yeah. Do you feel like a lot of people say, that SUBOXONE is overprescribed and doctors are pushing it on pain patients. What do you think it's overprescribed? And what do you feel about treating people's pain with buprenorphine?
So, it's an interesting thing. And if buprenorphine works for your pain, you're lucky, right? You have this very
Totally.
safe, very safe, because buprenorphine has a ceiling effect, right? So you can only get so much receptor activation with it, no matter how much you take. And so for people for whom it works for pain, that's awesome. There's a little bit of a legal gray area, which is that prescribe. So again, gets in the nuts and bolts a little bit, but in order to prescribe SUBOXONE for the treatment of addictive disorders, you need a special DEA number. You have patient caps and limits on how many people you can treat and so on. The use of it for pain gets into sort of a gray area, but if you're being treated for your addictive disorder, even if you haven't used it in a really long time, if you have an opioid use disorder, you have an opioid use disorder, and if it helps your pain, that's even better. So lucky day for those folks. The other thing that can happen is when people with pain have taken opioids for a long time, there can be an opioid hyperalgesia syndrome where the more they take them, now it gets just this like not taking it hurts, taking it hurts, everything hurts. And so those folks can particularly benefit from replacing the opioid with buprenorphine because it has that ceiling effect. So you can work through the hyperalgesia syndrome.
Yeah. Okay, cool. I have a lot of people. I have people in the chat right now that are on buprenorphine for pain management. And so if they were to come to you guys, would they be able to see you for that, or would they need to see a pain management doctor?
If they have an opioid use, so again, it's like
it's okay if they have the OUD.
If you've misused opioids in the past, if you feel like you can't stop using opioids, if you've dose escalated, right, if opioids have gotten in the way of you living your life, those are all the criteria for opioid use disorder. So you have an opioid use disorder. The fact that you have pain that may have caused the opioid use disorder or be the consequence of the opioid use disorder, but that's okay too. So as long as you have an opioid use disorder, you can get treated, by our providers.
Yeah. Okay, cool. Okay. I feel like I'm trying to think of if there's any questions that I need to ask you. Oh, yeah. Okay. So how much SUBOXONE is a person allowed to get prescribed to them? And do you guys allow people to be prescribed medical marijuana and benzos by their doctors? Because I know you guys only do bupe, right?
Yeah. So we only do bupe. So marijuana is not going to be an issue. Like, marijuana is a complex question. It might be worth getting into a little bit. Obviously, marijuana is medicalized, but not because it got an AFDA approvals. It got medicalized by legislatures, which is a pretty unusual way to make something into a medicine. Increasingly, I'm sure folks who are listening live in states where marijuana is now legal on a state level or a city level or whatever. Yep. Oh, here too, New York just opened. This is New York City behind me.
Oh, wow, cool.
This is the 85th floor of the World Trade Center, so we're looking out over basically.
You working there? That is so cool.
Marijuana is not. It's not. Certainly, it's not as dangerous as injecting opioids or taking opioids in any way. No one dies of marijuana overdoses, right? And now that there's a more regulated supply, you're more likely to be getting exactly what you think you're getting. If you find yourself using marijuana every day, just take stock of the fact that, you know, a lot of folks use it for anxiety, but find that over time they need to use more and more to get the same results with their anxiety. We know that marijuana down-regulate. So this again, we get into receptors and nerdy science guy, but
No, it's okay.
essentially almost any drug that you take, you know, in excess will cause downregulation of the system it activates, which means you need more and more to get the same effect. Things like marijuana, consider taking occasional holidays, take a few weeks off, see how you feel, check in with yourself. You know, I can't tell you on a global level that it's helping you, hurting you, or is not doing anything for you. Again, this is one of those things that is very different on a case by case basis, but using marijuana is not grounds to like be refused treatment for your opioid use disorder. Benzos are a complicated issue as well. You know, for a long time we thought chronic benzodiazepines were okay. You know, people
We did. Yes.
And the history of that's interesting because if you think about benzodiazepines replaced barbiturates, and barbiturates are like as dangerous as opioids, if not more dangerous. And you think about all like the famous actresses in the 50s died of these combination alcohol and barbiturates. So it's, boy, are benzos a lot safer than barbiturates. And benzos as a single drug overdose death are really rare. Now, in combination with other drugs, benzodiazepines can contribute to respiratory suppression. So particularly if you're injecting opioids or taking opioids another way, you want to be really careful with taking benzodiazepines at the same time because that combination really reduces your respiratory drive in overdose. So different providers have different level of tolerance for concomitant or taken at the same time benzodiazepines and buprenorphine. But in general, if both providers, the provider of the buprenorphine and the provider of the benzodiazepines, know about each other and are able to communicate with each other, there are ways that can be done safely.
Good.
And it's easy for benzodiazepine doses to creep up. So just like everything else, be cognizant of that if you're a good candidate for long-term benzodiazepines, you got to kind of be a good candidate to be on the same dose for a long time because there's only so much you can go, so high you can go. So if you discover that for, you know, on benzos, it's, you know, Klonopin twice a day, 1 milligram twice a day, and then now it's Klonopin 3 times a day, and now it's Klonopin 2 milligrams twice a day. If you find that to get the same effect, your dose keeps going up, you're probably not a good candidate for long-term benzodiazepine treatment. You need to find something else for your anxiety with your doctor.
We could do a whole show on benzos. I mean, I have so many people that reach out to me because their doctors are cutting them off of benzos. And the other doctor that I work for, he actually specializes in doing like really low and long tapers with people to get them off safely. But I mean, I could go on and on and on. But I just wanted to make sure, you know, as long as both providers are connected, and the patient is honest with the provider, then they should be okay. I know I don't want to keep you on too long here because I know you probably have other things that you need to do.
I did block the hours, so people
okay, cool.
Are still paying attention. Happy to hang. Yeah.
Okay, so what I have here, can I ask you a question from the audience? It's not about Bupe, but she really wants me to ask you.
Yeah.
Feel free to say I can't answer that if you can't.
So the thing I probably can't do on here is provide specific. So because we don't have a doctor-patient relationship, what I really can't do is provide specific patient-level medical advice. But if this is someone who is a recovery delivered patient, they should whatever their specific question is, they should tell their provider, and that provider can try to answer on their own, or certainly if it's something where that provider feels like they need to chat with me, they always have access to me. So you know, I hate to dodge a question, but
no, you're fine.
Okay.
I'm going to give it to you generalized. So okay. What if somebody's using weed to help them as an antidepressant, but they don't want to smoke anymore because, well, they need to make changes. Maybe they want to get a job. I don't know, somewhere that's like a, you know, important job. They don't allow you to smoke weed, but they want to get on antidepressants to help them to be able to quit smoking weed. Do people do that? Do doctors help people transition off marijuana like that? Is it safe to just stop smoking, or should they kind of titrate down?
So the marijuana, we've always, the sort of conventional wisdom has been there's no withdrawal syndrome for marijuana. That's not true. There is, and anyone
Yeah.
who's smoked a substantial amount of weed knows that if you suddenly stop, you're going to feel different. You could be sleepless. You could be either very hungry or not hungry at all. Again, everybody kind of reacts to these things differently. You absolutely can get psychiatric care from someone who you say, look, I'm smoking a ton of weed. It has helped with my depression, but I need to stop, and start on antidepressants. There are, if you have specific side effects from stopping marijuana, there are medicines that can help. So like if you have loss of appetite, and so you're like, losing weight, you don't mean to be losing, there are antidepressants like Remeron that as a side effect cause you to be hungrier. So that might be a good drug for you. Remeron also makes you sleepy at night. So if a side effect of not smoking is that now you can't sleep at night, well, that combination, if you're not hungry and you're not sleeping, well, maybe Remeron's the right drug for you to it's also called mirtazapine, for you to start on. But that's something you work through with your doctor. I think that and again, I know folks have been, if you've been using long enough and you've been seeking healthcare long enough, you've had bad experiences with the healthcare system. I mean, even not using, you probably had bad experiences with the healthcare system. But of trying to avoid stigma by not disclosing will bite you. And
Yeah.
and the best thing you can do, is try to find a provider who you trust enough to tell what's really going on, and then try to work together toward your goals. And again, a good sign that you're dealing with a provider who's going to be able to do this with you is that they're interested in what your goals are for yourself, and they want to engage in those goals. They don't come in with a preset goal for you.
Right. Okay. Thank you. So let's say somebody comes in and they're a patient at Recovery Delivered. Okay. And they are having all these freaking negative side effects from SUBOXONE, which is something that unfortunately comes with the territory sometimes. Example, constipation, sweating, weight gain, just a slew of things, low sex drive. If they're honest with their provider about what's going on, like what are some things that they can do to combat, like the constipation, the low sex drive? I know some guys have low testosterone from being on opioids for a really long time. What are some, things that we can do to help out with that?
So this is another case. So at some level, dose adjustment can help, right? So
Yeah.
if you can tolerate, true of every medicine in the world, you want the lowest dose that does what you need it to do. And so we can work with you to try to titrate your dose around a little bit and see if we can find an effective dose that doesn't make you so constipated or doesn't lower your sex drive so much. And then again, because we're not your PCP and we're not your psychiatrist, we can help communicate through you or directly with them about some other ideas. But a stool softener is often all it takes, right? And that's over the counter, something like Dulcolax, to just sort of get your bowel at least, working well enough that not being able to poop is a real bummer.
It is.
So your provider, even your Recovery Delivered prescriber, if it's not another prescription you need, if it's just some suggestions about some over-the-counter stuff, that's great. There are antidepressants that can boost your sex drive. So a lot of the SRI class can have the same effect, right? It can reduce sex drive. SRIs can also cause anorgasmia, which is usually the more troublesome thing, which is that
I've had that before, and it was horrible. It was Paxil that did it to me.
Yep. Yeah, wanting to have sex and not being able to finish usually gets people pretty bummed out about the medicine.
Yeah.
And people are embarrassed to go talk to their doctor about it because, it's something you're not used to talking to someone you don't see all the time about. And so, but bring these, the more that you're able to bring the troubles that you're having honestly and openly to your providers, is really a care team ultimately, the more likely we are to be able to get you, either we get you on something that helps or work with your other providers to make sure that your quality of life is what it should be. The other thing is the more distance you put between yourself and substance misuse, the more your body will sort of normalize, right? And so being on a stable dose of buprenorphine over time, sometimes the side effects will just sort of go away on their own, right? And so right dose, consistent, distance, time off of street drugs are often all it takes for people to start to just feel normal, right? That's the goal, to feel normal.
When I first got on subs, I started on 8 milligrams, and they bumped me up to 12, and I was on 12 milligrams for like 2 or 3 years. And I would sweat like I just sweat. I'd be standing here just like stripping off of me. It was I was miserable. So I went to my doctor. I was like, I'm miserable, dude. I cannot stop sweating. And he offered to prescribe me something to help me not sweat. But what we did instead was we tapered my dose down. And once I got below about 6 milligrams, I think I was like at 4, I don't sweat no more. I have no problem sweating. I also, once I got down lower, I was able to not have to take stool softeners or take fiber. And so if somebody comes in and they've been on buprenorphine like me for 8 years almost, and they want to stay on buprenorphine, they don't want to get off. Is Recovery Delivered supportive of that? Or are they going to say, hey, we need to taper you down, it's time? Like, do you guys make that decision, or do you talk to the patient?
There's no preset time course. It's just, this is such an individual decision, and it's an individual, it's an individual sort of, how your brain works. And so the way I think about taper is pretty straightforward. We have increments that we can work in, and it's really half the strip. I've had people cut them in quarters so you can go slow, and you start trying it. So, let's say you're on the absolute, highest dose that most people don't need, but you're taking 8 3 times a day.
Mm-hmm.
But pretty hefty dose, and you're having side effects. You want to try to start to taper off. You think you're doing well in your recovery. You might try, the total. This is like, don't try this at home without your doctor, but you might try cutting that middle dose in half. So now you're doing 8 or 8. Okay, do that for a couple of weeks. How are you feeling? Are you feeling like you feeling urges to use, or are you having any sort of breakthrough threat of relapse? And if not, okay, well, let's see if we can't take that middle dose out altogether. Okay, now you're on 16. We've cut the dose by a third. It took a month. No big deal. You want to keep going lower? All right, well, now why don't we take a half off the morning dose or a half off the night dose and see how you do. But sitting at the new dose for a little while and seeing what it feels like is absolutely critical. And some people can find that over, weeks to months, they're doing great on, 2 milligrams twice a day or 1 milligram. We can start to use the smaller strips, and you cut them, and there are a lot of ways to do this, but it really is patient dependent and all about how you feel as the dose is being decreased.
It's fascinating to me how much more beneficial SUBOXONE is to me at lower doses than it was when I was at a higher dose. When I was at 12 milligrams, I felt really lethargic and almost like a black cloud was starting to hang over me. And I shifted in my personality where all I really wanted to do was like lay around the house and watch TV. And when I started my taper and got down lower, it lifted that. And I don't know how to explain it. Like, I get more pain relief at a lower dose of SUBOXONE. I have, little to no side effects now. And it's just, I don't ever want to tell anybody, hey, go lower on your dose. But like, I try to share that to let people know that it really did help me. It's scary to taper, but as long as you don't jump like every day. A lot of people will call me up and say, hey, Nicole, I'm starting my taper. I'm thinking about dropping it 8 milligrams this week, 2 milligrams next week, just like week. And I'm like, no, dude, no, that's too fast, Yeah. And so I just try to support people through that, the tapering process. But I know that's like a lot of things that people are afraid of, and they want to make sure that they're going to be successful. So it makes me happy to hear that you have the same beliefs as I do about tapering slowly over a long period of time, taking it easy.
Yeah, and you learn a lot about your own brain in the process. You learn what rate of decrease works for you. And so, anytime you try a taper, you try something. And if that's really uncomfortable, okay, well, then you need to go slower, right? If you tolerate it, no problem, well, maybe that's the right speed. Maybe you can even go faster. But the only urgent thing is if you're using, you urgently should be trying to stop, right? Once you're in treatment, the rest of it, changes in treatment just aren't usually that urgent, right? And so like being patient with yourself, accepting that this is a process. Listening to your story, I'm struck by you put some distance between yourself and your problematic drug use. So over time, as your brain starts to reset a little bit, the way that the buprenorphine works in you changed. and you were
Yeah, it did.
you were responsive to it. You took some action. You tested something. It worked. You tested, right. And so a lot of this is about just figuring out your own sort of rhythms and what you need for yourself. Actually, I see a question in the chat that I'm happy to
Yeah,
answer.
go
That is,
ahead.
after being on subs for a while, will the patient ever need to go up after time because they become tolerant to their dose? We don't usually see that. Now, sometimes people need to go up because they have a life stressor, right? That's sort of pushing them toward relapse, and that's fine. But the nature of buprenorphine, the way this, I talked about before, the agonist, antagonist, or partial agonist aspect of it means that it doesn't build up tolerance the way that a lot of full agonist drugs do, because the receptors aren't being downregulated because they're not being fully activated. So in general, you don't see. It's not like, a lot of folks on benzos end up having to be dose escalated over time. Like I said, now if you have to be dose escalated benzos, you're not a good candidate for long-term benzodiazepines. But most people on bup end up going down over time.
Yeah. I think because I thought the same thing. I had never taken SUBOXONE when I got on it. When I first took it, I thought, wow, this is great. Am I going to feel this way every time I take it? No, you're not. It's going to stabilize. And you literally feel like I take a vitamin. That's what it feels like I take every day. I feel no euphoria, no kind of like anything change when I take my medication every single day as prescribed. So it's not a tolerance that you build. It's the medication. That's how it's designed to work.
That's it.
So that
That's
way,
exactly right. Once you're stable on treatment, it feels like nothing. It really ought to feel like nothing.
right. And I think that what happens is we come from, opioids, and we were thinking, man, I'm going to get on this medication. It's going to be just like methadone. Because see, when I took methadone, I would take it and I would take more because it was giving me this like awesome feeling. And I became like madly addicted to it and overtaking it and like really bad, struggling. I think a lot of people have a misconception about SUBOXONE that that's going to be kind of like the same experience,
Yeah, exactly. I mean, this is exactly, taking a vitamin is a great analogy. Also,
That's exactly what it's like. I feel absolutely nothing.
A great analogy for folks who are being given a hard time by people in their life about taking this is like, I'm no more addicted to this than I am to my multivitamin.
Yeah. I mean, that's okay. So here in our little community, it's actually a really big community now, but I just want to advocate for people to have, the freedom to choose what they would like to do for their recovery, to support them, meet them where they're at in recovery. And that's why, I love Recovery Delivered, and I'll always, share. I've been sharing about you guys for 2 years, since 2020. That's how much I believe in the program. And I just really respect you so much for coming on and even talking with us. I do want to ask you one last question. Okay, so if somebody that's watching right now is they're freaking out there, they're strung out, they're watching this video right now, they're crying, they feel like they need to make a change, but they don't know what to do. What would you advise them to do? How can we help them?
Reach out to us. You already said the process. If you can get online and do it. If you need to make a phone call, make a phone call. But this your next fix doesn't have to be street drugs. You can get rid of that uncomfortable feeling that makes you go seek out drugs with a medicine. And if you're in withdrawal right now, there's another option rather than taking something you just bought on the street that could kill you. I know this. I know the risk from a very scientific standpoint, but fundamentally, when you don't know from shot to shot in a given bag, when you can't predict how potent that shot's going to be, you can't use drugs safely. There's really, and we see people dying of fentanyl overdoses from sniffing cocaine now, because from bump to bump or line to line, if there's fentanyl in that bag, you have no idea how many granules of fentanyl are mixed in with the granules of whatever else is in there. And so, and fentanyl and stronger now, right? We're getting things that are even more potent than fentanyl mixed in. I don't believe there's any way to safely use white powder drugs right now.
I don't think so either.
That's I know that it's a big change. I know it requires sort of reconceiving how your day is going to look later today and tomorrow, but there is this other option and it's treatment, and it's finding support, and it's moving away from the folks who you engage for drugs with drugs and all these, these other things. Yeah, it's hard. It's hard to make change. It's hard to make any change, particularly this one. But there are other options. There's safer options. There are options that let you try to start to form goals that don't revolve around where you're going to get the next bag.
Yeah. Thank you so much for coming on and hanging out with me today and sharing, with everybody. I'll email you, but I would love to have you on again, and we could talk about like benzos. Like that would be an amazing video, and people would love that.
Yeah.
So I will email you. You guys, if you want to get in touch with Recovery Delivered, I put a link in the chat. All you have to do is click the link, go to the website, download the app. Once you're getting ready to pay, you can give them my name, Nicole, and they'll give you 50% off your first appointment, which only makes it like $49, I think. So super, super duper affordable. And if you need peer support or any kind of meeting support, I got you. We got Mara meetings, and then I got a bunch of girls and guys that are peer support specialists. They'll be lined up to help you guys, okay? I'm going to let you go, Dr. Dan, so that way you can get back to work. Thank you so much for coming on with us.
Yeah, thanks for having me, and thanks for everybody who asked questions and commented in the chat. It's really neat to see that level of engagement. So good luck, everybody.
All right, thank you.
Bye-bye.
See you later. Oh, you guys, I really like him. Okay, so that was Dr. Dan Karlin from recoverydelivered.com. I really like him, you guys. He's like a Dr. B, don't you think? Who all in here watches Dr. B too? So he gives me Dr. B vibes. Like he's totally like harm reduction, meeting you where you're at, supporting you, encouraging you to make goals and achieve them. Like I really like him a lot. Okay, so I wanted to have him on to share. He's like, the head over the program. Of course, he doesn't treat the patients. He oversees all the doctors, the nurse practitioners, and the physicians that treat you guys that are doing Recovery Delivered. If you have any questions about Recovery Delivered and you didn't get to hear it in this video, you can message me. I'll put my cell phone number in the chat, and you could just text me the question and I will answer it for you gladly. Okay. I want to wrap this up by telling you all this. Okay. Before I got on SUBOXONE, I was so ashamed. I had been using drugs for almost 20 years. Okay, and I lost custody of my son to the state of Arkansas. And I had always said since I was young that I would never, ever shoot up drugs. And I did. And I would never, ever lose custody of my son or use drugs while I was pregnant. And I did every single one of those things, every single one. When I went into treatment, I felt so much shame and guilt. And even more so when I went to get on SUBOXONE. So what I try to do here is create a community of people that are going to support you in your decision to get on SUBOXONE and not judge you for it. Because we're already judging ourselves. I was so mad at myself that I couldn't get sobriety like everybody else could. I was so mad at myself, And so I know that you guys probably feel the same way. So I just want you to know, if you're watching this video and you have been thinking about getting on SUBOXONE, but the stigma of being on MAT has just really affected you, you have a place here with us. And I will literally go to war for you guys if people are being disrespectful to you about being on SUBOXONE or methadone. Okay, I will help you. And we have an amazing community. There's an amazing meeting place called MARA, which is Medication Assisted Recovery Anonymous. Okay, where that's a whole community where you can actually do organized meetings if you're on medication assisted treatment, and they're so accepting, and it's just amazing. So I want you guys to know that there's plenty of resources and support for you. Don't sit back and wait because of other people's opinion of you getting on Butte. Okay, do not fuck what they say. Okay, screw what they say. All right, you're literally going to die if you continue doing fentanyl. That's all there is now, fentanyl. If you stay out there and you continue using, you will die. It's only a matter of time, honey. It's only a matter of time. So if you're in withdrawal today, right now, honey, you can be on buprenorphine by tomorrow morning, or maybe even later today if they got a spot open. It's quick turnaround. You get in, they see you, you get your medication, and then you can reach out to me through my phone number, and I will hook you up with all the peer support. I'll even help you find an addiction counselor if you need one. Okay? I'm willing to do that work for you guys if you guys are needing help with it. Thanks, Pixie. It was never your intention to harm your baby. It was your own mind trying to survive by yourself. I realized that today, but when I was really struggling, you guys, it was really hard, and I still beat myself up about it to this day. So I just want you guys out there that are, maybe struggling still, maybe you're still using drugs. I want you to know that, like, yeah, I've been sober for almost 8 years, but I'm not so far away from drugs that I don't remember the pain that I experienced, and the pain that I put my family through, and the pain that I have caused my son. So I want you to know that I understand, and I know it's hard. I really do. Choosing to change my life was the hardest thing I've ever done, because I had become so comfortable in my addiction. I had become comfortable in that lifestyle. So changing it was difficult, but I found good people that were in recovery that I looked up to surround myself with. And that's what I suggest for you. Find people who have what you want, who you look at them and you're like, well, they're sober. They've got a job. They're happy. I'm going to start following them. I'm going to ask them if I can hang out with them, go to a meeting with them, and take notes and just take one day at a time. Don't rush. Okay. Just one day, 1 second sometimes at a time, okay? And I'm always here to help you guys if y'all need any support, okay? So I'm going to get off here because I don't want to go too long. I love you guys. I'm going to upload this video to YouTube. I know a bunch more people will watch it this evening because that's usually my peak time here on YouTube. But I love you guys so, so much, and I will upload this video and put the Recovery Delivered link in the chat in the description. And thank you guys so much. I'll see you later. Bye.